And joining us now with more on New York City's vaccine mandate is emergency medicine physician Dr. Manish Garg. And I want to welcome you to BNC. You probably are looking at this from a different point of view than most of us because not only you're a doctor, you're a resident there, you've been on the front lines seeing things that we, don't get to see. So what are your thoughts? Because today over 22,000 first responders have been placed on unpaid leave over failing to get the vaccine. You guys are already seeing staff shortages in your area. So what does this mean for the city going forward?
Well, thank you, Laverne. It's wonderful to be on the show. And I just wanted to start off by saying that my thoughts are my own, and I certainly have no conflicts of interest with any of the pharmaceutical industry. So your question about how do we feel in the medical community, I mean, certainly myself, I work in three different emergency departments in New York City. The fire rescue, the EMS, the police, these are our brothers and sisters. They work with us to help the patients to protect and serve. So this definitely hits home for us in the emergency department. I would say that, when you look at the numbers of folks that right now have been put on administrative leave, we're talking about 9,000 of 378,000. So when you do the math, it comes out to about 2.4%. This is a very important percent because each person is important. But from a public health standpoint, which is what we're trying to tout, this is a really important initiative. And right now, what we have butting heads is the autonomy and freedom on one side, and that particular argument versus the collective public safety on the other side. And certainly myself, seeing cases of COVID coming in and seeing the wrath of COVID in March and April in New York City, you can see why we on the public health side just want everybody to be protected, including the fire rescue, EMS, firefighters, municipal workers.
Being that you are on the front lines, aren't you worried about being able to operate at full capacity with so many workers who are not going to be showing up to work? I mean, doesn't that put all of you at risk, everybody?
It certainly does. I think one of the things that we learn in emergency medicine is crisis management and disaster training. So we are pretty facile at when volumes do surge. Certainly, it requires a lot of us to do extra tasks. So there are a lot of times where we end up having to do tasks, just to make sure that the whole system works. But there's a built-in resilience within the system, and every patient that comes in from the community is an important patient, and we need to make sure that we're there for them.
And New York City, of course, has a large black and brown population. According to the CDC, as of October 18th, only 11% of African Americans are vaccinated. I'm kind of surprised to hear this. So how will this affect the black community? Is this racial disparities working against communities of color? What do you see as the problem?
Well, I think, Laverne, that's a really important question because really it's about the messaging. And I think it's really important from a public health standpoint. They talked about how misinformation and disinformation have become public health emergencies. That is so true. And I think it's really important that people go to the sources that they're going to trust when it comes to their healthcare and safety for themselves and their families. And that would be going to see your doctor. And so I think it's really important. We service a large black and brown community. We love our patients. We want them to have really good health outcomes. And I think that certainly for myself, I've tried to go on different types of social and media platforms just to try to make sure that I'm able to reach out to different people to make sure that they get the vaccines. I think in the black and brown community, one of the things that has been historically there has been the distrust about medicine and distrust about experimentation. And so when you hear these chants from protesters about, my body, my choice, I think one of the things that people aren't realizing is that, this COVID pandemic is really affecting everybody. And so it's more than just that individual choice. You're actually impacting a number of different people. And then the second thing that you'll hear from the protesters is this hashtag natural immunity. And I really want to just spend a little moment addressing that issue. So one, the virus itself is not part of any natural part of our process. It's an invader with foreign machinery. And the vaccine similarly is something that mimics that foreign invader. And one of the things I've heard from a lot of people is that, oh, if you put this in me, it's not a natural way. But that's not true. What's happening with the vaccine is it's making your natural immune response react to protect you against this foreign invader should it come back for either for the first time or the second time. And another misconception that we see in the Black and brown community, as well as the white community, everybody, is that if I got COVID one time, then I have, immunity now, and now I don't need to get any more. And that's not true, because when we go and are taking care of patients in the emergency department, one of the things that I see is that people who have been infected before can get infected a second time, particularly if it was just through COVID. And we're seeing that all the time. If you've been immunized, your chance of getting infected, passing it on, if you've gotten the vaccine, your chances are so much lower for all of those. So it really is the best public health strategy that we have. And there are a number of cities in this country where the African American population has taken on the vaccine more than the white population. And that's very, very encouraging, especially since the Black and brown community have a lot more significant consequences if they don't protect themselves, somewhere on the order of 3 to 4 times. So it's really important that we get the message out, that we are helping everybody, and that people are really listening to their trusted sources.
Yeah, there's really is still so much misinformation, and I thank you so much for clearing things up for us and appreciate all you do as a healthcare provider. Dr. Manish Garg, New York City emergency medicine physician. Thank you so much for joining us here on BNC.